Hello friends, today is our medical discussion episode number 26. Today our topic is piles. Sir, my first question is to you that there are a lot of confusion about piles. So what is actually piles and what are the causes?
So, you have said right that there are a lot of confusion regarding the terminology of piles. So, whenever a person feels anal pain or he feels or he has blood in his stool, then he immediately says that I have piles. So it's not like that. There is a definite condition where we use the term piles or the hemorrhoids. So piles or hemorrhoids is said when their blood vessels or the veins of the anal canal, they usually swell up. Actually there are certain veins or in the certain positions of our anal canal, mainly in the 3 o'clock, 6 o'clock and 12 o'clock position. These are certain blood vessels in the anal canal, and whenever because of certain conditions these blood vessels it swells up to the extent that it becomes engorged and sometimes even blocks the anal canal or sometimes can prolapse downward. So this condition we term as piles or hemorrhoids. Normally there are two types of piles or hemorrhoids. One is called the external piles and another is the internal piles. So whenever these blood vessels get engorged externally in the or outside the anal canal or in the lower part of the anal canal, we term it as external piles. And whenever this blood vessel swells or gets engorged in the upper part of the anal canal, we term it as internal hemorrhoids. Normally, the main cause of hemorrhoids is chronic constipation. Whenever a person suffers from constipation for a long duration, he usually uses more force or more abdominal pressure to pass stool, and because of this increased pressure within the abdominal cavity, there is engorgement of the blood vessels in the anal canal, and therefore they suffer from piles. Moreover, certain people who suffer from chronic constipation, like persons who is suffering from hypothyroidism, or if they are taking any medications which can cause chronic constipation, also leads to the development of piles. In pregnancy, because of the increase in abdominal pressure, abdominal pressure, and in pregnancy females usually suffer from constipation. So pregnancy is an important cause of piles, which is usually temporary. Moreover, if the person suffers from certain psychological disorders that cause them to go to the bathroom repeatedly and apply pressure to pass stool, such conditions also ultimately lead to the development of the piles. Moreover, if a person has chronic constipation due to certain other causes like lack of dietary fibers, lack of water in the diet, such persons also ultimately land up in developing piles. So piles, we specifically use the term in those conditions where people develop the engorgement of the blood vessels or veins in the anal canal.
Thank you, sir. My next question is to you that sir, what are the different kind of signs symptoms can be seen in case of piles?
So normally, if the person has if the early development of the piles, they don't have usually any symptoms. The signs and symptoms of the piles occurs when the engorgement of the blood vessels increases to such an extent that they get prolapsed or they come downward outside the anal canal and can be seen from outside as a lump. So whenever these blood vessels, they swell up, get engorged, and sometimes even there can be clot formation within these blood vessels leading to severe pain, even during passing of stool, or even when the person is not passing stool. Because of the clot formation or within these blood vessels, he can experience severe pain. Moreover, when a person have chronic constipation, there is friction between the stool and these blood vessels leading to the erosions, ulcer formations, and there can be even pain during passing of stool. Whenever a person has chronic constipation, even these blood vessels can rupture, leading to the passing of stool where there is blood streak, or even there can be severe passing of blood during passing of stool, or even after the passage of stool. So normally in the early period there are no such symptoms, but with the passage of time there can be severe pain, there can be ulcerations, erosions leading to the passing of blood with or without the passing of stool. So these are the main symptoms. Whenever a person has this type of symptoms, then the person usually suffers from anemia because of the chronic passage of blood in the stool, and they may suffer from fatigability. He may need to get blood transfusion. Sometimes a person because of these piles, because of the erosions within the anal canal, there can be infection within the anal canal leading to the development of pain or and fever if this infection go to the bloodstream. So the person can have fever, can have pain, can have even severe sepsis if a person develop infection within the anal canal.
What are the most common complications that can be seen in case of chronic piles?
So normally in the early part of the piles there are no such complications, but if a person has chronic constipation or the chronic piles, because of the regular passage of blood or regular blood tinged passing of the stool, a person can suffer from anemia, or he may have severe anemia leading to the development of increased fatigability, and he may need even blood transfusion. Sometimes because of the piles there can be infection within the anal canal leading to the development of the fever or even sometimes severe sepsis. Moreover, if a person suffers from piles for a longer duration, there can be formation of fistula. Fistula is the development of the opening both outside and inside the anal canal, and these fistulas can also cause infection within the anal canal and the development of severe pain in the anal canal. So these are some of the most common complications which are seen in patients with piles and suffering from a longer duration. Sometimes the engorgement of the blood vessels becomes so much that there can be complete obliteration of the anal canal, and the person may even may not be able to pass stool, and this leads to the development of more constipation, and a chronic cycle goes on.
What are the treatment and modalities can be seen in case of piles?
Normally, if a person has suffered from the early development of the piles, the main treatment is the softening of the stool. We have already discussed that the most important cause of the development of piles is chronic constipation. So prevention is better. A person should take lot of fiber in his diet. A fiber person should drink plenty of water so that his stool is not hardened or he doesn't suffer from constipation. Preventing constipation will also prevent the development of the piles. So if a person has chronic constipation, he should look out the cause, what is causing the constipation. Increasing fiber and liquid diet in the food helps in some way. With that, a patient should also look after if he is taking medication that cause constipation, he should stop it. He should look for other diseases, like if he is suffering from hypothyroidism, he should treat accordingly. If a person is suffering from liver disease, it can also cause development of the piles and should treat accordingly. If the person has pain while passing stool, there are certain ointment which contain local anesthetic, and use of that ointment will help to reduce the pain while passing stool. Moreover, there are certain steroids ointment which help to reduce the inflammation within the anal canal and also reduce the pain while passing the stool. There is a technique called sitz bath. It is usually sitting without dressed or naked in a container containing warm water with betadine solution. This technique helps to reduce the inflammation within the anal canal and also help to reduce the pain while passing of this stool. However, if this method doesn't work and the person still suffer from this engorgement of the blood vessels, he may visit the surgeon and there are certain injections that can be given in these blood vessels which prevent the engorgement and reduce the pain. If still the person has severe piles and has also prolapse of the these blood vessels, then there is a operation called hemorrhoidectomy where these blood engorged blood vessels are removed. So these are some of the treatment modalities and some of the techniques by which a person can prevent as well as can treat the development of the piles.
Thank you, sir. We have learned so many things today. Hope you will like it. Sir, what we would like to request to the audience last.
So normally the piles, it is used in a variety of conditions by the common people. Actually not all conditions refer to the piles. Piles or hemorrhoids we say when the blood vessels within the anal canal they get engorged because of chronic constipation, because of chronic increase in intra-abdominal pressure. So whenever a person develops such a condition, the most important thing he should do is to avoid constipation. He should visit the surgeon once to look after if there is other causes of development of anal pain or passing of blood in the stool, because there are certain other conditions like fissures, even can be diverticulitis, or there can be infections within the large intestine, or there can be even development of cancer within the large intestine which can cause blood in stool. So not all blood in stool occur because of piles, but however if a person has problem of piles, he should visit the surgeon and treat accordingly. So I hope this video is very useful to all of you and to know about the piles and how to diagnose and how to treat piles. I hope you will all like, share and subscribe our channel. Thank you all.